Assalamu alaikum. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about the anti-Parkinson's drugs. At first, I am going to tell about the Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder of the muscle movement that is characterized by tremor, muscle rigidity, bradykinesia, postural and gait abnormalities. Etiology. The etiology of the Parkinsonism is especially unknown. Disease is correlated with the destruction of the dopaminergic neuron in the substantia nigra with the consequent reduction of the dopamine action in the corpus striatum. It is the part of basal ganglia system that are involved in the motor control. So that the normal inhibitory influence of the dopamine on cholinergic neuron in the neostriatum is significantly diminished, resulting in overactivity and overproduction of the acetylcholine by the stimulatory neurons. Parkinsonism reflects an imbalance between the excitatory cholinergic neurons and greatly diminished number of the inhibitory dopaminergic neurons. Now, the secondary Parkinsonism, drug-induced Parkinsonism or pseudo-Parkinsonism. Drugs such as phenothiazine, haloperidol may produce the Parkinson's syndrome, so it is also called the pseudo-Parkinsonism. Our treatment strategy: restoring the dopamine in basal ganglia and antagonizing the excitatory effect of the cholinergic neuron and re-establishing the correct dopamine and acetylcholine balance. What are the anti-Parkinson's drugs? There are two categories of anti-Parkinson's drug. One is drug that affecting the brain dopaminergic system and another is drug that affecting the brain cholinergic system. The drug affecting the brain dopaminergic systems are dopamine precursor levodopa, peripheral dopa decarboxylase inhibitors carbidopa, dopamine agonist bromocriptine, ropeninol and pramipexole, MAO-B inhibitor selegiline, COMT inhibitor entacapone, tolcapone and dopamine facilitator amantadine. And then the drugs that affecting the brain cholinergic systems, anticholinergic drugs. Among anticholinergic drugs, benzhexol, benztropine, procyclidine, bipyridine are used as anti-Parkinson's drug. Levodopa. What is the mechanism of levodopa? Dopamine cannot cross the blood-brain barrier, so its immediate precursor levodopa is used in Parkinson's disease. It is transported into the central nervous system and converted into the dopamine by the help of enzyme dopa decarboxylase in the central nervous system. But the enzyme is also present in the peripheral tissue and gut, so they also metabolized in the periphery. Levodopa must be administered with carbidopa. Without carbidopa, much of levodopa is decarboxylated to the dopamine in the peripheral tissue and gut and resulting in nausea, vomiting, cardiac arrhythmia and hypotension. Now, carbidopa. Carbidopa is a dopa decarboxylase enzyme inhibitor. It diminishes the metabolism of the levodopa only in the peripheral tissue, thereby increasing the availability of the levodopa in the central nervous system. In addition, carbidopa lowers the dose of the levodopa needed by 4 to 5 folds and consequently decrease the severity of the side effect arising from the peripherally formed dopamine. What are the benefits of combination use of the levodopa with carbidopa? Plasma half-life of the levodopa is prolonged when it is used in combination with carbidopa. The dose is reduced approximately 1/4 of previous dose. Peripheral conversion of dopamine is reduced. The peripheral adverse effects like nausea, vomiting are not prominent in using the combination drug. Cardiac complications like cardiac arrhythmia, hypotension, etc. are minimized in case of combination therapy. Pyridoxine reversal of the levodopa effect is not occur in case of combination therapy, and on-off effects is minimized in case of combination. Degree of improvement is higher in case of use with levodopa along with carbidopa. What are the adverse effects of levodopa? When the levodopa is given without carbidopa, then there are several adverse effects like GIT adverse effect, anorexia, nausea, vomiting due to stimulation of the chemoreceptor trigger zone. Secondly, cardiovascular effect. Tachycardia, ventricular extrasystole, atrial fibrillation, postural hypotension, hypertensive crisis are common serious adverse effect. Now, the central nervous system adverse effect. Visual and auditory hallucination, abnormal involuntary movement or dyskinesia, that is occur 80% of the patient taking levodopa therapy for more than 10 years. After years, the levodopa level control Parkinsonism. After years, the level of control of Parkinsonian symptomatology starts slowing fluctuation, and on-off effects occur. Patient may alternatively well and disable. Drug holiday. Discontinuation of the drug for 3 to 21 days may temporarily improve the responsiveness of the levodopa and elevate some of its adverse effect. Little help in management of on-off phenomenon. Behavioral adverse effect. Mood change, depression, psychosis, anxiety, delusion, hallucination, insomnia, nightmare, somnolence, euphoria, confusion, agitation, etc. And others are mydriasis, blood dyscrasiasis, positive comb test with evidence of the hemolysis. It may precipitate the gout and acute glaucoma, abnormalities of smell and taste sensation, brownish discoloration of the saliva, urine, vaginal secretion and elevation of the blood urea nitrogen, raised serum transaminase and alkaline phosphatase and bilirubin level. Contraindications: psychotic patient, patient with angle closure glaucoma, acute gout, patient with cardiac disease like cardiac arrhythmia, active peptic ulcer disease or GIT bleeding, patient with history of melanoma or active malignant melanoma and undiagnosed skin lesion. Thank you all. That is all for today.